Welcome to this COVID-19 update for pregnant women and families in Australia and New Zealand at the time of this COVID-19 pandemic. This week has been a great wake-up call for Australia for two reasons. First, there has been a significant rise in the number of coronavirus cases in Victoria, with many coming from community transmission. This new increase in cases came at a time when most of our states and territories, and New Zealand as a nation, were seeing a pleasing reduction in infections, and our governments were lifting many of the restrictions on our daily lives. It now appears that we may have been too optimistic. COVID-19 is still with us, and if we are not smart, Australia may now see a second wave. Don't forget that in the 1919 influenza epidemic, the second wave killed more people than did the first wave. Second, we now have much more information on pregnancy outcomes from other countries where the pandemic has been widespread, providing us with a clearer picture of the implications for women who are pregnant and their unborn children. One good thing has not changed. All available information continues to tell us that COVID-19 does not particularly target pregnancy, and if a pregnant woman becomes infected, the distribution of outcomes is similar to the rest of the community. We now have much greater numbers to support that statement. However, the international experience has shown that pregnancy is in no way protective. Some pregnant women, if infected with COVID-19, will develop severe disease, and there have been deaths reported overseas. COVID-19 infection in pregnancy does not cause preterm labour, but can result in early birth because of the need to deliver the baby to help the woman with her breathing. In many of the international case series, the babies have been delivered well before full term and by caesarean section. While this practice would definitely be of benefit in helping the woman with her breathing, it is far from ideal for the child. So COVID-19 infection in pregnancy can be serious for the mother, and the treatment can result in the baby being born earlier than it should. Both can be dangerous. And there is another problem for the long term that we do not yet understand. Whether or not the COVID-19 infection causes serious illness at the time, there may be long-lasting effects on our lungs and possibly other organs that are not yet clear. Nor do we know how these ongoing problems can be prevented in people who have the infection. The best thing that a pregnant woman can do to protect herself and her baby is avoid getting the infection. Across our communities, many people have come to assume that the risk of the pandemic has passed. That is very understandable. Almost everyone has done a terrific job following the instructions from our governments and health departments, and we are now sick of the restrictions and keen to get back to our usual lives. But we must not be so complacent. It is too early to let our guard down. If we relax our standards now, we are inviting a second wave, which may be worse than the first. So please, follow the instructions from our leaders, and whatever other rules in your area, and especially if you are pregnant, maintain your social distances, wash your hands frequently, and be alert to high-risk situations. We need to face up to the reality of our situation. COVID-19 infection will be with us for a long time. We can dream of a vaccination, but there is no guarantee that one will be developed anytime soon. COVID-19 is a serious illness. It is a very smart virus. It can produce no symptoms at all, leading the person to think they are not infectious when in fact they are. And it can cause serious issues for all people, including pregnant women and unborn babies. It is time for us all to listen carefully to the messages coming our way and to adapt to our new normal of potentially living with the long-term threat of this infection. But at the same time, living our lives as best as we can, going about our daily business and watching out for our mental health and avoiding undue anxiety. And that includes watching out for those around us and helping all of us to get safely to the other side of this pandemic. That ends this update for pregnant women and families. I'll be back next time with any new information that may have arisen. Until then, stay well. Thank you.